Hi, everyone. Welcome to today's Rural Health Transformation Program webinar, our first webinar for this program here in New Mexico. I'm Elisa Reed. I'm the Acting Rural Health Director here at the Healthcare Authority, overseeing the Rural Health Transformation Program. So welcome, everyone. Today's webinar, we took questions ahead of time, so we will not have a Q&A live for participants during the session. But I do have questions that have been put in ahead of time, and I'll be answering those at the end of today's session. So welcome. We hope that this provides you with a really good high-level overview of our Rural Health Transformation Program, and we will have opportunities in the future for additional questions and more content. All right, and before we start today, I want to humbly acknowledge that we are here on the ancestral lands of the original peoples of the Pueblo, Apache, and Dene, past, present, and future. And I just want to say I love living in New Mexico. This is my home. I so appreciate living here. It's so beautiful right now. The air even smells amazing this spring. So I'm so loving being here, and I love the people here. And I just want to pay my gratitude and respects to the land and the people and the communities that contribute to what is today known as the great state of New Mexico. And there's this beautiful photo here of Taos Pueblo. You can find out more about Taos Pueblo by going to their website. All right, and here at the Healthcare Authority, we are working to ensure New Mexicans attain their highest level of health by providing whole person, cost-effective, accessible, and high-quality healthcare and safety net services. And our vision is that every New Mexico has access to affordable healthcare coverage through a coordinated and seamless healthcare system. And you can see that the Healthcare Authority really is positioned very well to do the work of transforming rural healthcare. So we're really excited and proud to be facilitating this grant and these monies on behalf of New Mexico. All right, so quick agenda, things we're going to cover today include a program overview for rural health transformation, program timeline, funding opportunities, very high level on application process, stakeholder engagement, and then our key questions that were pre-submitted and some next steps. All right, so the New Mexico Rural Health Transformation Program is a 5-year federal initiative. So we were approved by CMS for this money in December of 2025 under a competitive notice of funding opportunity. Our $740.89. That's a big number to say for year one. Was the 13th highest in the country for an award. So we're really proud of the application that we put together on behalf of New Mexico to be able to lead this work. We are in this work focused on access to care, workforce, sustainability, and data to improve health outcomes across rural, frontier, and tribal communities. And we will be delivering that through 5 program initiatives that I'll give more detail on here in a moment. All right, so you can see that our anticipated 5-year program budget is just about $1 billion. That federal investment will continue so long as we are focused on really implementing and having positive outcomes in this program. We really want to design this to improve access and workforce sustainability, financial sustainability, and data infrastructure. Our 5 strategic initiatives include Healthy Horizons to expand specialty care, maternal health, chronic disease management, and digital health access. We have Rooted in New Mexico, which will help build and retain a rural health workforce pipeline. Rural Health Innovation Fund, which are community-driven rural health solutions to help us transform healthcare in rural New Mexico. Bridge to Resilience, providing technical assistance and services and sustainability to support rural providers, and a rural health data hub to strengthen our data analytics, transparency, and planning. All right, from a timeline perspective, you can see that in September of 2025, CMS, the Centers for Medicaid and Medicare Services, opened up a notice of funding opportunity for all states. We developed an application. I'll talk a little bit more here in a moment of how we gathered information for that application and how we designed this program. Our submission deadline was fairly quick. So November of 2025, we submitted the New Mexico application, and our award was given to us on December 31st. So you can see over the last several months, we've been working on program governance, staffing, and how we're going to procure and fund this program. Right now, we are in just the beginning of the procurement and contracting period. I will talk more about that and how to access funding in just a moment. We do have a reporting, our very first report to the federal government, to CMS, is due August 30th, 2026. So we want to do as much work as we can between now and that reporting deadline. Our first year of funding, the $211 million, we will be able to use that funding through October 30th, 2026. We'll be able to use that funding through September 30th, 2027. My apologies. Our funding must be obligated. So obligated meaning contracts signed, agreements in place, people hired. That's what's due October 30th, 26. But we can continue to use our federal fiscal year $26 through September 30th, 27. So we do have additional time to use money that we were allocated just recently. All right, so how we built this program, we did do a high-level needs identification process for rural access. That's really where we started to figure out what is it that rural communities need. We did a stakeholder input process. We received over 140 requests for information responses and statewide engagement. So we really did listen to our partners and rural communities in the design of this application and this project. We also worked across agencies, other state agencies, including Department of Health, ECCD, and others, on how we should best align the work with those agencies and be able to deliver a state strategy. In December, we defined that strategy and the 5 key initiatives designed to address those needs that were identified. And then again, funding was secured in December, and we've also established our program governance here at the Healthcare Authority. All right, so just a little more about what we heard from stakeholders that influenced our application. We received feedback from vendors, local vendors, providers, hospitals and health systems, health plans, associations, and advocacy organizations. The top themes that came out of those were access and care delivery. This is probably no surprise to you who do work here in New Mexico that that's number one. Number two, workforce development to really help expand that access and be able to retain the workforce that we have today. Infrastructure and data. So technology interoperability and data platforms, and really staying on top of what's happening now in technology with all of the advancements with AI and data, really being able to understand and plan how we're going to use data in the best way possible. Telehealth and digital health, really seeing how we can best leverage digital health, wearable technologies, et cetera, to really support communities who need more access to care, and behavioral health, more integration, crisis response, and prevention. So all of those themes very much directly influenced our application that was submitted. So you'll see that all of those ideas, thoughts, and needs were considered in the design of this project. All right, so before we talk about details, I just want to talk about what we think success would look like in this program. So we really want to see care closer to home. We know that people are driving long distances, many hours, depending on the type of care needs that they have. If we can bring some of those care needs closer to where people live, access to care will improve and it'll be less of a hardship on those communities to access that care. Earlier coordinated care, so really leaning on those care professionals and care coordination professionals to make sure that we can be as proactive as possible. Having stable providers. So again, like I talked about, not just growing our workforce, but how can we really retain and make sure that the workforce that we currently have feels supported, resulting really in that stronger workforce alongside initiatives to grow the workforce. And then community-led solutions. I know, and we know here at HCA that we don't have all the answers. If we did, we wouldn't have these issues. So we really need the voices of our communities, our rural communities, to continue to inform, talk to us, and let us know what the needs are and how we can best leverage the funding that we have available to really make this transformation happen. Okay, so just quickly, who's going to benefit from this rural health transformation program? Number one, patients and communities. That's our number one focus of who we hope will see the most benefit. Providers and care teams, the workforce, and state and regional systems. So if we can really strengthen our systems across rural New Mexico that are anchored in our urban centers as well, and really coordinate regional networks and shared services, we hope that really strengthens rural access. Okay. So we have two similar-ish programs. You all may have heard of the Rural Healthcare Delivery Fund. Its naming is very similar to the Rural Health Transformation Program. I just want to give a really high-level differentiation between the two because I think there is a little bit of confusion out there about how they're different, how they're the same, and why we have these two. The Rural Health Delivery Fund was started in 2023 by the legislature. At the time, it was to help grow access to care in rural communities. So we opened up RFA for that. We had a lot of response and a lot of partnerships that came out of those applications to grow services in New Mexico. We also received $50 million in this last special session to move from growing to stabilization. So that application process is now closed. We're in the middle of deciding who has access to that funding or who we're going to approve for that funding. That notification should come out in the coming months. But that fund now is really meant to stabilize the existing clinics, hospitals, and systems that exist in rural communities. So doors stay open in order for us to do this transformation program. We're really fortunate here in New Mexico that we have the funding to do this stabilization funding so that our transformation work can actually happen and we can really start to think about sustainability. So the Rural Health Transformation Program excuse me, is really that. It's really meant to transform how rural healthcare is delivered. We know how it's delivered today is not working. So how are we going to change so that we can get the services needed into these communities? So this is an investment in workforce and technology and in care models. And it's really to support system-wide improvement. So not necessarily a individual service access expansion like what happened in Rural Healthcare Delivery Fund, but really like a statewide improvement across rural communities and improving access and redesigning, again, how care is delivered. All right, I'm going to take a pause for just a moment. All right, and we'll dive into the Rural Health Program 5 initiatives. So this should give you a little more detail into each of the 5 initiatives. So starting with Healthy Horizons, and you can see up in the upper right-hand corner how much funding that we have right now that we have allocated for each of the programs. That is definitely subject to change by HCA and subject to CMS approval. But we wanted to give you an idea of what the funding would look like for each of these programs. All right, so Healthy Horizons is really about expanding access to specialty, maternal, and behavioral health care. So what we know and what we heard is patients have to travel too far for care. There's limited specialists, and care is very hard to coordinate in rural communities. Healthy Horizons is going to help us expand specialty and maternal care, enable telehealth and remote care practices, and improve care coordination. So what we hope to do with Healthy Horizons is have faster access to care, fewer avoidable hospital visits. We hope they're affordable, but which we'll work on as well, better integrated care and stronger rural providers. So we will have 6 centers of excellence, 6 regions identified to anchor this work in. Those centers will work with local partners, hospitals, health centers, communities, providers, patients, to really identify what the specific needs and what specific work will happen in those regions. I'll talk about how that works from a funding perspective in a moment. And then they will provide some statewide support as well. So we will have a Healthy Horizons application opening soon, and we will have even more details about how that will function. All right, the next is rooted in New Mexico. So what we heard here is that we need more recruitment and retention and getting providers to come and stay in rural communities is very difficult. So training does not always lead to rural placement as well with the programs that we have existing, and workforce pipelines are limited. So Rooted in New Mexico is really going to help us expand education and training pathways and increase rural and clinical placements and support recruitment and retention. We really want to see more providers in rural communities of all kinds, reduce workforce shortages, and stronger and more stable care teams. We will have training and education partnerships, not only to grow the workforce, add more providers, but also to help our existing providers work at the very top of their license and to offer as many services as possible in existing communities. Offering rural training and placement with rural clinical rotation, expanded residencies, and local placements. And then retention programs, incentives, and pathways tied to long-term rural service. Those things will include payment for potentially for housing and different to resolve some of the different things that we've heard that are really needed within rural communities to help providers be able to move to and stay in rural communities. The Rural Health Innovation Fund is really built to empower communities to design and lead local solutions. So what we heard from folks is that there's no one size fits all solution. And a lot of those one size fits all solutions that do come along are not always effective, especially in rural communities. Communities need flexibility to solve local challenges, and that funding sometimes does not meet local priorities. So we want to offer competitive grant funding for not just providers, but for anyone who can support a community design solution and address local health and social needs. We need and hope to have more community-led programs, strong local ownership of those programs, and sustainable solutions over time. So we will have competitive funding and opportunities for communities to apply for that funding. And we hope to have very local design and leadership for these projects. We also will have accountability and sustainability along the way to make sure that the dollars that we spend are really making the difference that we hope they will in communities. Bridge to Resilience is meant to stabilize and sustain rural providers by strengthening the systems that really sustain access to care. All right, so providers, we know, are financially strained. That will continue to be something that is on the minds of rural providers going into the changes with Medicaid and Medicare. Care teams lack capacity to improve operations. We know that you all are working incredibly hard every single day to take care of your communities, and that doesn't leave a lot of time to do capacity building and to do the other nice to haves and nice to dos for your businesses. And rural providers really need additional support. We, under the Bridge to Resilience, will establish a Center for Rural Health, Sustainability, and Innovation. This center will help provide hands-on technical support and back office operational support for providers, hospitals, clinics, and others, and really enable shared services and partnerships so that the things that you want to do that you don't have time to do are attainable. We really hope that this helps create more stability for rural providers and sustainability, that we have a reduced risk of closure and stronger regional collaborations out of this center. So again, we're calling lovingly CRHSI, CRHSI, the Center for Rural Health Sustainability and Innovation, will really be that central hub for provider support. We will provide that hands-on technical assistance, operational, financial, clinical, hiring, you name it, kind of a soup to nuts operational backbone for rural healthcare. And we will also leverage peer learning and shared services through that center. The Rural Health Data Hub is going to help us use data that exists and receive new data to improve planning, coordination, and decision-making. So we heard from our communities that rural providers sometimes do not have the data that they need to do the work. Data is hard to access or hard to use, and there is a need for more visibility into community needs. So our Rural Health Data Hub will create a shared data platform. It'll connect data across systems and provide information and tools for decision-making. We expect to have an enhanced access for data-informed decisions, improved system coordination and interoperability, and greater transparency. What this looks like is having integrated data systems, so bringing together existing state and partner data. and building accessible tools and dashboards that are user-friendly and that really show the data that you all tell us is important and useful to you. Training and support. So helping others interpret and apply data. So we will not just provide the data, but we will also help you understand how to use the data and have access to the data as well. All right. So before we talk too much about the funding mechanisms and how to access funding opportunities, I want to be really clear about what we can and cannot, well, we cannot use this money for. These are restrictions based on the funding opportunity from the Centers for Medicare and Medicaid Services. These are federal guidelines, so they're not movable. All right, so we cannot replace or duplicate payment for clinical services that are reimbursable by Medicaid, Medicare, or other payers. We cannot supplant existing federal, state, local, or private funding sources. So if a funding already exists, this funding cannot come in and replace that funding. We cannot cover pre-award costs or unrelated expenses not allowable for the project. We cannot fund construction, building expansion, or major capital improvements. We cannot pay for goods or services that are the legal responsibility of another entity, like an education, vocational rehabilitation, or civil rights obligation. We cannot support lobbying or activities intended to influence legislation or policy using federal funds. And there are some additional project-specific restrictions. Funding clinical services that duplicate billable services or alter existing fee schedules are not allowed. New construction or large-scale facility expansion projects are not allowed. Certain technology and equipment purchases restricted under federal regulations would not be approved. And using funds to finance the non-federal share of Medicaid or other programs would not be allowed. And there is a website you can go to find more information about those restrictions. Okay, so here's more of the fun part, which is how to access this funding. All right, so funding pathways. There are several ways that the healthcare authority will leverage to build the infrastructure and the programmatic side of this project. So number one, and first and foremost, the majority of the funding will be awarded through requests for applications or requests for procurement. In some cases, we will have direct awards and agreements, especially for services where we have statewide price agreements in place. A lot of those are some of our more infrastructure-based agreements, software, et cetera. We will also utilize interagency partnerships. So we will be able to direct New Mexico state government agreements or have direct payments to other state government entities. Subawards. We will have subaward processes through Healthy Horizons and other initiatives where funding can be directed towards the needs that are identified by those regions. So regions will put together what their needs are, what they'd like to see happen, a plan for having those things happen, and then have a subaward process for those activities. And strategic partnership agreements. So we may have existing contracts in place that we can leverage for some of this work as well. All right, so current open funding opportunities include the Administrative Services Organization, RFP. This is really to provide HCA with the administrative and operational support we need to advance these initiatives. They will be helping us with contract management, financial processes, and reporting structures to make sure that we can be successful in this work. The other open RFP we have right now is the Center for Rural Health, Sustainability, and Innovation, CRISI. This center is providing the administrative and operational support across RHT program initiatives. This is incorrect. I don't know why I had that on there. ASO will do the contract management, but they will, CRISI will really do the, I understand, I know what I did wrong here. I put ASOs down there. CRISI will be the backbone for operations for our rural providers. So really providing that technical assistance. Apologies for the error on my slide. The technical assistance and opportunities to help our rural providers. The submission for the ASO is due May 28th, 2026, and submission for CRISI is due June 4th, 2026. There are other opportunities coming. They will all be posted to the Rural Health Transformation Program webpage as soon as they are available. And Hayla, I'll have you pop the link to that webpage in the chat. Actually, there's no chat, so there might not be, but I'll make sure you have access to that before the end. All right. So we also will have a stakeholder advisory committee opportunity for New Mexico. We really want to have a board or body that can help guide the Rural Health Transformation Program implementation. We know that again, HCA is not the expert in what's happening in rural communities. You are. And so we need you. We need your support in really making this something that is meaningful for rural communities. So we would really like to have we will have a structured advisory committee to bring perspectives from rural, frontier, and tribal communities, and so that we can be transparent and have alignment across our stakeholders. For the membership for this advisory committee, we will include our state agency partners. We will include providers, community-based organizations, IHS and Tribal 638 representatives, state associations and legislative representation, as well as rural, frontier, and tribal members. We will meet quarterly, and the coordination will happen between PMO, that means Project Management Office here at the Healthcare Authority, and with CRISI. We will operate, this advisory committee will operate in an advisory capacity, and we hope that 20% or more of the members are community representative. We'd really like as many members as possible to be in rural communities. All right, so participation will be coming soon. I'll share a little bit more about timing for that in a moment. But we hope to have a strong meeting format and schedule details before we open that member selection to make sure that you all know ahead of time what the expectations are for participation. All right, so we will have an application process for many of the members, especially those that are providers, community-based organizations, IHS and Tribal 638 representatives, and rural, frontier, and tribal community members. The application will become available through the HCA Rural Health Transformation website, and we will have that application process reviewed by HCA leadership. We want to make sure that we have as diverse of a set of voices as we can on that committee, and we will do that final selection here at HCA. We hope to have that application open mid-June. We're hoping June 15th, but I didn't want to promise that date quite yet until we have all of our information together, but we do anticipate mid-June for that application to open. Selection will be based on representation across regions. We want to have as diverse group of stakeholders and voices as we can to help us inform this work. Some of the committee membership from state agencies, associations, and legislative representatives will be pre-selected through our conversations with those organizations, and those groups would not need to apply. All right. So I will leave this slide up for a bit so you all have a chance to write down our webpage and engagement opportunities. If you go to the webpage under Stay Connected, you will find the other links that are on this page. So don't feel like you have to write down the forms.monday.com or the apply for funding. If you go to the Stay Connected, you can find those other links. So we hope that you go to our website and come often to our website. We continue to grow and improve that with more information on a regular basis. We hope that you will sign up for our distribution list. That's this forms from monday.com. You can tell us where you reside so we can give some targeted communication to you. And this will also give you where to go to apply for funding. And again, around mid-June, we will open that application, as well as open the other RFPs and RFAs, all on that website. Okay. That was a lot of me talking to you all. I hope that you learned quite a bit today. Thank you to those of you who pre-submitted questions. We do have a few questions to go through. If there are additional questions that you have, we will have another way for those questions to come through. For the most part, if you have a specific question on one of the funding opportunities or a specific question about one of the RFAs or RFPs, please hold those questions until we have the opportunity to release the RFA or RFP. There's an official process for folks to submit specific questions for those funding opportunities within those RFAs and RFPs. So go to those documents and you'll be able to submit those questions there. All right, I'll take another sip of water here. Okay, we'll dive into some of the questions and I'll try to get to as many as I can. I may be able to get through all of them. We'll give it a go. All right. So our first question is, who is eligible to apply for rural health transformation funding and how is rural defined? All right, so eligibility varies by initiative and funding mechanism, whether we're doing direct subawards versus a competitive procurement for applications. Eligible applicants may include rural hospitals and clinics, FQHCs, tribal governments and tribal health organizations, community-based organizations, education and training entities, and others serving rural, frontier, or tribal communities. We will give a preference wherever necessary and wherever we can for New Mexico-based organizations and those who are currently supporting and doing work in New Mexico. For the definition for rural, the Rural Health Transformation Fund uses a different definition than we do for the Rural Health Delivery Fund. Rural is being defined for this program using the Health Resources and Services Administration, or HRSA, rural definition, with funding focused on HRSA-defined rural census tracts and explicit emphasis on frontier areas and the state's 23 tribes, nations, and pueblos. So if you go to the HRSA site, you can find that definition. You can also find it in our application. So CMS guidance here states that funds must benefit the rural populations identified in our approved application, even if those differ from those HRSA designations. So what is in our application is what we can fund as far as from a rural New Mexico perspective. All right, our next question is the Rural Health Transformation Program limited to Medicaid funded providers or specific payer types? So if you've applied for funding for the Rural Health Delivery Fund, you know that funding opportunity is restricted to Medicaid providers. While HCA including Medicaid population being a major focus. We are not requiring that the folks applying for funding are Medicaid providers. We know that this transformation work, while we want as much of this work as possible to benefit Medicaid patients as well, we know that it's bigger than that. And so we really need all hands on deck, right? We need to strengthen our rural health systems more broadly. And so we're not limiting funding to specifically to Medicaid providers or a specific payer mix. All right, the next question is, can organizations apply for more than one funding opportunity or initiative? The answer to that is yes. So organizations may participate in more than one of the RHT initiatives if you meet the initiative's specific eligibility criteria. We will make that eligibility criteria very clear in the RFPs and RFAs that we post online. All right, next question is, can multiple organizations partner on an application, including vendors? I really love this question because I really support, and we at HCA really support partnerships and collaboration across different funding partners, different organizations to really strengthen the work. So yes, joint applications, subcontracting, and vendor partnerships are permitted and encouraged where appropriate to support the implementation of this program. And just an extra note that CMS guidance states that states may support collaborations between rural and non-rural partners when rural residents are the primary beneficiaries. So as we know, a lot of resources exist outside of rural communities. So we really would encourage you all to think about how you can partner with rural communities or vice versa, rural communities partnering with urban access and resources to bring those services and that access into rural communities. Okay. The next question I have is, how will applications be evaluated and selected? This also can vary by initiative and funding mechanism. So the specific selection criteria and scoring methodologies are all detailed within the individual RFPs, RFAs, or application materials posted online. I would encourage you to go to our website and pull those RFAs and RFPs to see the scoring matrices and our selection process for each individual funding opportunity. All right, the next question is, what is the structure and timing of rural health transformation funding? So hopefully you've learned a little bit more about that in our presentation, but just to give a high-level overview again, the New Mexico Rural Health Transformation Program is a 5-year initiative, so federal fiscal year 26 through federal fiscal year 2030. The state application assumes approximately $200 million per year, with phased implementation beginning this year in 2026 and expansion in subsequent years, subject to CMS requirements and performance monitoring. New Mexico anticipates early planning, tool development, and readiness activities this year that we've already begun, followed by the release of the majority of RFPs and RFAs mid-May through mid-June, with contracts executed by the end of September. Exact timing is going to vary by initiative and will be communicated through individual procurement and funding announcements as they're released. All right, the next question is, are funds provided upfront? And what are key rules and allowability and spending? All right, so funds will be distributed through our RFAs, RFPs, subawards, and they are those RFPs and RFAs are competitively awarded. If you remember, there were several different ways that HCA can have agreements and funding through this opportunity. Contracts or grants can be designed different ways. So when we get into the scopes of work, deliverables, and reporting requirements for an individual contract, it could be everything from an hourly payment structure to a deliverable model where we pay for that performance. A lot of, I think what this question is coming from is how we designed and paid for the work under rural health delivery fund, where we did allow for small independent practices, especially to get money up front. That commitment would be on a case-by-case basis. So we do understand that there are cases where, especially with smaller rural providers, where there's just not that ability to have funding to do this work upfront. And so the state will take those on a case-by-case basis to decide what the best funding mechanism will be. All right, next question is, what types of projects are most appropriate for Rural Health Innovation Fund? The Rural Health Innovation Fund is supporting community-designed, community-led projects that address local, rural, frontier, or tribal needs. Examples might include non-Medicaid or medical drivers of health, preventative care, behavioral health services, patient safety improvements, limited facility or equipment investments. So you can go to our state application to see more of those ideas, but we really want to see truly your innovations, things that maybe we haven't thought of, things that will really support the transformation of rural healthcare. They could be statewide approaches or individual community approaches. It doesn't have to be one or the other. All right, and the final question we have for today is, what support, oversight, and transparency can participants expect? This is a really great question. We will here at HCA provide oversight and support for the centralized implementation and technical assistance through that Center for Rural Health Sustainability and Innovation. And we will also convene a stakeholder advisory committee. We will provide program level progress and results. We will share those publicly as an aggregate in a privacy compliant manner. We expect to share our updates both on our website and through our distribution list. We're planning a regular newsletter for you all to keep you informed on what's happening with this program. And we do want to be as transparent and open as possible with you all about the progress, outcomes, expectations, and funding opportunities that come along the way. All right, well, that completed our webinar for today. I want to say thank you to all of you for the work that you do in New Mexico. I've met many of you who are providers. I know, family members who live here that struggle with the same things that everyone else is struggling with here in New Mexico with access to care. And I really appreciate the care and commitment that you all have for taking care of New Mexicans. I look forward to working with some of you or many of you in the future, and looking forward to having you all follow along with this project along the way. Thank you, and I hope to talk to you all soon.